Rabies is most commonly transmitted through a bite. Other possible routes of exposure include contamination of mucous membranes like your eyes, nose, or mouth with wet saliva or central nervous system tissue, or getting wet saliva or central nervous system tissue in a fresh open wound. Organ transplantation from a person infected with rabies has also been documented as a route of infection. Rarely, aerosol transmission may also occur, but this is typically only a concern in laboratory settings or in caves that contain a lot of bats. The touching or handling of a potentially rabid animal is only considered an exposure if wet saliva or CNS material from the potentially rabid animal entered a fresh, open wound or had contact with a mucous membrane. The rabies virus cannot enter intact skin. When the rabies virus enters the body, it travels up through the peripheral nervous system into the spinal cord and then enters the brain. In the brain, the rabies virus causes an inflammation known as encephalitis. This inflammation can cause a number of clinical signs. Clinical presentation may vary within and among the type of livestock infected. Livestock species and horses may show signs of rabies infection by not eating and being less active. Often animals with rabies will have behavior changes like becoming aggressive or excitable. Clinical signs of rabies can also include signs that would indicate something may be wrong with the animal's nervous system, and these can include lameness, paralysis, and seizures. Typically, once clinical signs of rabies appears, animals will become very ill very quickly and die or need to be euthanized within a few days of illness onset.